Hello, thank you for joining us today. We are welcoming you here to our webinar, Brief Intervention, or BI, for Marijuana. This series is part of the big hospital SBIRT initiative. We have a monthly series. This is one of our most exciting series to help us launch off the season, so we are really excited to be able to share this education with you today. I'm Tracy McPherson. I'm a Senior Research Scientist in the Substance Abuse, Mental Health, and Criminal Justice Studies Department at NORC at the University of Chicago. I co-lead the big initiative, and I am also a lead trainer and technical assistant staff on the National SBIRT ATTC, which is co-sponsoring this webinar today. The National Screening, Brief Intervention, and Referral to Treatment ATTC, or the National SBIRT ATTC, is a joint collaboration with IRETA and NORC at the University of Chicago. It is funded by SAMHSA, and we hope that you will look us up and visit us. We have two wonderful webinar series, one hosted by the big initiative, which is part of the one I mentioned today. And IRETA also has a full series of webinars that they're hosting monthly as well. And I will post a link for you in the chat box so you can take advantage of going to their site and seeing the resources that we're able to offer in addition to our webinar series, as well as some of the wonderful toolkits and training materials and free resources that are made available to you. They're in the public domain for you to help support your efforts to learn more about SBIRT, to implement it in your settings in a wide variety of settings, not just medical, but community and workplace and so forth. So I will post those links, and I hope you will see us as a one-stop shop suite of services around SBIRT and meeting your needs. And today I'd like to just cover some brief information for you before we get started, just a few housekeeping items about how you can best participate in today's webinar. The tool we are using today is called GoToWebinar, and GoToWebinar has a control panel you can see on the right of your screen. This can be minimized and expanded by pressing the orange arrow. Doing this will allow you to see your entire screen during the presentation. You can always reopen it by pressing the orange arrow again. The presentation is being recorded and will be posted on our website for later viewing. I will send you a link to this recording later today if everything goes as planned. If you are using computer speakers to listen in today and you're having trouble getting the volume higher, I recommend switching to a phone line. We have no ability to control the volume output, but this switch seems to solve most of the problems. All attendees for the live broadcast have been entered into what is called listen-only mode, and this means that your microphones are muted, so we'll not be able to hear you during the presentation. However, you have the ability to send questions to the staff and to the presenter through the questions pane. And that can be done during the presentation, and I will hold those questions, and at the end we'll be having a question and answer session. And we'll try to get to all of them, but if for some reason we can't, we'll get to as many as possible. And if our presenter is able to answer some of those at a later date or later time following the webinar, we'll try to post some questions and answers if we're able to do that. But I'm hoping that we'll have sufficient time for questions. If you wish to download the PowerPoint slides, you can do so from the link that's posted in your chat box or the links that are posted on our website for future reference. And if you wish to receive 1.5 free CEs for participating in this webinar, please complete the online CE quiz with the link that will be posted in the chat box at the end of the presentation. Also, we would be very grateful, in addition to completing that CE quiz, if you would complete a very, very brief evaluation form. This link will also be posted in the chat box at the end of the presentation. And I cannot stress to you enough how important it is for us to receive these evaluations. Much of our ability to be able to continue to support this kind of education and bring you quality education and great speakers like Carolyn Swenson is by being able to report on how we're doing. And so completing those evaluations is really important to really helping us bring the quality education to you that you all have come to expect from this team. So it's my pleasure to introduce to you Carolyn Swenson. She will be presenting today on a very hot topic, something we're hearing a lot about and keeping our eye on this topic for some time, and I expect that this will be a topic of great interest to many, many people working in a variety of settings, brief intervention for marijuana. Not only will she be talking about her experiences in Colorado, but I think we'll be able to learn a lot from her experience that can be applied to other states across the U.S. So I know I've certainly been looking forward to this presentation for some time. So Carolyn Swenson is a family nurse practitioner with additional training in public health. She works at HealthTeamWorks, a nonprofit organization focused on healthcare quality improvement, where she coordinates clinical guideline development and provides training on motivational interviewing, prevention, depression, childhood and adult obesity, tobacco, and SBIRT, substance use screening and brief intervention. She is also a certified QPR suicide prevention trainer. Over the course of her career, she has worked as a public health nurse on the Navajo Reservation with migrant farm workers in refugee healthcare in Africa, with immigrant survivors of torture, and coordinating population-based research in rural Colorado. So it's my pleasure to introduce Carolyn and to hand the presentation over to Carolyn now. Welcome, Carolyn.
Thank you, Tracy. Thank you, everyone, for joining this webinar today. The information that will be presented today draws from health literature on marijuana, but especially draws from our ongoing collective experience of figuring out how to address marijuana as a health issue in Colorado. And we look forward to the comments and insights of the participants, of all of you, in this webinar today. So I would first like to acknowledge the funding and leadership provided by the SBIRT initiative in Colorado, which is funded by SAMHSA. Colorado is in its second 5-year SBIRT grant from SAMHSA. So the objectives for the presentation today are, first of all, to briefly review what is screening and brief intervention as a method to prevent and reduce problematic use of alcohol and other drugs. Second, to review marijuana legislation and patterns of marijuana use in Colorado. Third, to review the known risks of marijuana, especially health risks, in both adolescents and adults. And fourth, to explore key points for effective brief interventions to prevent and reduce the harms of marijuana use in both adolescents and adults. So let's start by reviewing what is screening and brief intervention, also known as SBI. So first of all, the screening part. Screening involves administering one or more validated screening questions or tests to identify a potential problematic use of alcohol or other drugs. Sometimes screening is done in 2 parts, as a brief screen followed by further screening using a validated tool such as the audit or the DAST. And when a level of risk is identified that needs further attention, a brief intervention is provided. A brief intervention can include one or more than one brief conversations to raise a person's awareness of potential or current health risks related to their use of alcohol or other drugs, and especially to motivate that person to change their pattern of use and prevent or minimize problems now and in the future. For a person who has more problematic use of alcohol or drugs and a possible substance use disorder, a brief intervention can be used to motivate them to seek further evaluation and more intensive or specialized treatment. So what do we know about screening and brief intervention for marijuana? Does it work? Well, honestly, it is an unanswered question. There have been many fewer trials of screening and brief intervention for drugs than for alcohol. The United States Preventive Services Task Force, also known as USPSTF, has issued an insufficient evidence grade on illicit drug use, screening and brief intervention for illicit drug use in adults and adolescents. And just to review, the U.S. Preventive Services Task Force is an independent group of experts that completes a rigorous review of the evidence for a wide range of screening and other prevention interventions in primary care. And so, as I said, they've concluded that there's insufficient evidence at this point to issue a recommendation for or against screening and brief intervention for drug use. It's important to note that that does not mean that SBI, or screening and brief intervention, is certain to be ineffective. There's just simply not enough evidence yet to draw a conclusion. And so in Colorado, as in several other states now, marijuana no longer technically fits into the category of illegal or illicit as a drug. In Colorado, anecdotal feedback from our SBIRT implementation suggests that marijuana is actually one of the most difficult substances to address in a healthcare setting. So we have more to learn, but we are learning from our work in Colorado, and I'll be sharing that information with you today. So Colorado, as you probably all know, in the middle western United States, and we're having a snowstorm today, but we made it to the office. And in Colorado, marijuana has been legalized. In the year 2000, voters approved medical marijuana, and that was implemented in 2001. In 2012, voters approved recreational marijuana, and that was implemented in 2013. For thousands of years, marijuana has been used throughout the world for medical, recreational, and spiritual reasons. In the United States, it is still classified as a Schedule I substance under Federal Controlled Substances Act of 1970. In other words, it's illegal and it's viewed as without medical value. Despite this, marijuana became the most widely used illicit recreational drug in the United States. There are still many unanswered questions about the potential medical benefits of marijuana, largely because of the barriers to carrying out high-quality research on its potential medical benefits. At the same time, there are definitely known risks associated with marijuana use, especially in adolescents, young adults, and in some other subgroups of the general population. And we will review some of these health risks today in this presentation. But first, what do we know about marijuana use in Colorado? The data from the next few slides is from SBIRT implementation in Colorado, and it reports on marijuana use in adults. So overall, in our SBIRT healthcare settings in Colorado, more than 35% of adults reported lifetime use, and almost 15% reported use of marijuana in the past 90 days. And 10% or so reported daily or weekly use overall. And of those who reported marijuana use in Colorado, we found that of lifetime users, almost 9% had a medical marijuana card, and almost 20% of users in the past 3 months had a medical marijuana card. We've seen variance amongst the past 90-day users. medical marijuana card holders are actually likely to use more days of the month. On average, about 20 days of use in a 30-day period or in a month. Non-medical card holders were less likely to use daily, an average of about 13 days of use during the past month. So card holders, meaning medical marijuana card holders, used significantly more days in the past month than the non-card holders. We also have seen a difference in risk level amongst those who used in the past 90 days. Card holders were, about 90% of those were likely to score at moderate risk, while only about 3% were likely to score at moderate to high risk. And when we say higher risk, we're talking about a person who reports personal or social problems associated with marijuana use, such as difficulty cutting down or stopping, concerns from family or friends, legal, financial, or social problems due to use. Interestingly, the non-medical marijuana card holders were at about 7% likely to score at moderate risk, and 7%, more than twice as likely to score at high risk, so significantly more likely to be at high risk. We also have looked at co-occurrence of other substance use along with marijuana. Overall, those who reported using marijuana in the past 90 days were fairly likely to score positive for other substance use as well, especially alcohol, tobacco, and stimulants. Non-medical marijuana card holders were significantly more likely than the card holders to screen positive or at risk for alcohol, tobacco, and stimulants. So our conclusions from collecting data on marijuana use in Colorado shows that medical marijuana card holders were more likely to be at risk, especially moderate risk, likely due to their frequency of use, while non-card holders were more likely to screen at higher risk for marijuana use and to screen positive for other substances. So in Colorado, we are introducing a new question specifically to screen for marijuana use. We've worded the question like this: in the past year, how many times have you used marijuana? Any person who reports more than one time in the past year will be considered a positive brief screen that warrants further assessment and a brief intervention. A little other news from Colorado related to marijuana. These are both recent, fairly recent news reports that highlight a couple of the safety concerns related to marijuana. First of all, increased reports of young children ingesting marijuana, accidental ingestions, and then sometimes showing up at emergency rooms. Another concern is accidental ingestion of medical marijuana or any marijuana by pets, and this could include especially the edibles, by the way, edible marijuana products. So the cost of marijuana, it's a bit difficult to nail down exactly the cost of marijuana, and the information I'm sharing with you today are estimates that are anecdotal. I basically just asked around, and it's not too difficult to find people who know something about this in Colorado. But keep the costs in mind as we talk about possible motivations for a person to quit or cut back or to switch to other methods to address the reasons they're using marijuana. But in general, an ounce of medical marijuana could cost as much as $180. And for a person who uses medical marijuana about once a day, that supply would last about 2 weeks, I'm told. Edible marijuana for each edible could cost as much as $10. And non-medical or recreational marijuana could cost as much as $200 for 1 ounce. And of course, depending on how often it's used, that could last who knows how long. So if you go to the internet, as I have, and search for benefits of marijuana, you can find a lot of information. I've highlighted in this slide just some of the things you're likely to find. Some based on possibly high-quality research, but often extrapolating information to make very lofty claims about the benefits of marijuana, including that it may stop cancer from metastasizing, controlling certain types of epileptic seizures, which could be the case, actually, preventing blindness when a person has glaucoma, improving diabetes control, slowing progression of dementia, treatment for inflammatory bowel disease, and depression, amongst several other claims that you'll find on the internet. And certainly these things will come up when doing brief interventions for marijuana. So who gives health advice about marijuana? It's interesting that policies in healthcare institutions vary, and some actually discourage practitioners, physicians and other practitioners from advising patients at all about use of medical marijuana. We've heard that many medical marijuana dealers are ready to give advice and readily offer that medical advice to users. And so we've concluded that someone needs to be prepared to provide accurate, unbiased information to patients about marijuana. So in Colorado, in our SBIRT sites, we hear from the health educators about the common claims or common comments from patients about marijuana. And this slide highlights some of those things that tend to come up fairly frequently. You know, patients reporting or commenting that it's legal, which is absolutely true, and so why could it be a problem or a big deal? It's all natural. Actually, that's true as well. A lot of belief that no one has ever overdosed on marijuana or is likely to overdose on marijuana, that it could be safer than smoking tobacco cigarettes, maybe safer than narcotics, some people believe, and that it could treat serious health problems, could improve sleep and anxiety, help with handling stress. Some people believe that marijuana makes them actually a safer driver, or certainly that it's less harmful than using alcohol and then driving, and simply that it just isn't harmful. So that's a very common belief, that marijuana simply is not harmful. So now on to the brief intervention and the priorities for offering high-quality, effective brief interventions. So we've identified several main priorities. First of all, and a very important area, is to prevent use in adolescents. And in order to do that, to target both parents and others who work with youth, as well as the young people themselves, to provide accurate information and motivation to avoid marijuana. In some cases, to encourage abstinence, and for many people, to encourage reduction in use to reduce the harm from marijuana that could result, to promote harm reduction in those who are unwilling to abstain or cut back, to identify individuals that may have a cannabis use disorder and refer them for further assessment and possible treatment, to motivate those folks to actually follow through on treatment, and then to receive good recovery support services long term. So these are the main priorities of offering good brief interventions on marijuana that we're working on right now in Colorado. So let's talk next about prevention in adolescents. So the effects of legalization on the patterns of use of marijuana in youth are really not fully understood at this time. The question is still unanswered about whether legalization of marijuana and greater availability of marijuana is actually increasing or changing in any way patterns of use in youth. In Colorado, some school districts are concerned and even have information to suggest that marijuana may be now more commonly used than alcohol or tobacco. That certainly it is viewed as a likely gateway substance leading to other substance use. It seems very reasonable to be concerned that young people who use marijuana are more likely to experiment with alcohol and tobacco as well. So I'm sure that in Colorado we'll be looking for more indications about how legalization is affecting use in youth. But we know that we want to prevent use, and we want to denormalize any use of marijuana and other substances in adolescents and young adults, primarily for health reasons. We want to address the rationale that marijuana use is preferable to alcohol, even though, and I'll be talking a little later about the risks of driving after marijuana use as it compares to alcohol, any substance use is likely to impair driving, increase the likelihood of accidents and other harms to a young person's health and to others. We want to educate parents and youth about key issues related to marijuana, including how the as yet undeveloped adolescent and young adult brain is more susceptible to problems resulting from marijuana use, about the very real risk of long-term problems, especially related to learning, memory, some mental health disorders in those who are susceptible, and increased risk of psychosis. Cannabinoid hyperemesis syndrome, also known as cyclic vomiting, is something we are seeing more of in Colorado, especially in emergency rooms, and it results from chronic use, fairly heavy use, and a person simply has uncontrollable, miserable vomiting and often needs IV fluids. We know that marijuana use can diminish motor coordination and impair driving, and that use may be associated with other substances. And certainly we're seeing indications of that among the adult users in Colorado. So these are some of the key points that we want to emphasize as we try to prevent use in adolescents and reduce the harm to those adolescents who do use marijuana. So this slide summarizes some of the key points for having effective conversations with parents. Many of these suggestions come from NIDA, plus some other sources. First of all, to denormalize all adolescent substance use, to really counter the idea that substance use is simply a rite of passage and something that most adolescents will do. To be very non-judgmental, take advantage of all types of opportune moments to talk with a young person, not only by parents, but by other people, teachers, coaches, those who may work with young people. To create safety and opportunities for an adolescent to disclose use and to disclose that other people around them are using marijuana so that they feel safe talking about it. To respond honestly when questions may come up about the past use amongst parents and other adults, but to really focus and direct the conversation on the young person's life right now, and to not dwell too much on the past history of use that may exist for many parents, actually. To communicate a no-use expectation, to make that very clear and firm that a young person is expected to not use any substances. To provide information, especially about the vulnerability of the young brain, the developing brain, and other harms that can result from marijuana use. Some of the protective factors should be highlighted as well, to really promote family, school, neighborhood engagement, to be alert for any signs of deteriorating relationships, problems at school or in any part of a young person's life, so that those behavior issues and concerns can be addressed early. And then to definitely monitor for signs of access to drugs, whether that be in the neighborhood, at the school, at home, and any signs of use, of changes in behavior that might indicate a person's beginning to use marijuana or another substance. Pregnancy and lactation is another time when marijuana use should be addressed. THC, the main psychoactive substance in marijuana, does cross the placenta, and it should be considered a form of exposure during pregnancy. It is also present in breast milk and should be considered a form of exposure that should be avoided. Marijuana use while pregnant may increase the risk of miscarriage, and there is good evidence that prenatal exposure to marijuana is associated with several long-term problems, especially related to motor, mental health, and neurobehavioral development, including problems with learning and with attention, all the way through adolescence. An infant who's exposed prenatally or while breastfeeding may become more irritable and have more trouble with sleep due to the marijuana exposure. And then on to some of the health concerns in adults. This slide summarizes some of the major health concerns. First of all, the cardiac issues. We know that marijuana temporarily can increase heart rate and blood pressure, and that could be very harmful to a person who has existing heart disease. There is an increased risk of cardiac arrest and stroke associated with marijuana. Marijuana, especially smoked, is harmful to the lungs and is associated with chronic bronchitis, repeat upper respiratory infections, and pneumonia. And people who smoke marijuana, as compared with cigarettes, tend to inhale more deeply, which is one of the concerns about how marijuana may affect the lungs. Long-term chronic use of marijuana has been associated with decreased immune system function, especially a concern as adults get older and have other causes of immune system function deterioration. Marijuana has been associated with decreased fertility. And certain people, certain adults, should especially avoid or reduce marijuana. That would include people who are scheduled for surgery in the next 2 weeks, an individual who has current or a past history of mental health diagnosis, and individuals taking certain medications. And I'll be talking more about the medications in the next slide, but a bit more about the surgical risk. Marijuana may potentiate medications that are used during surgery and especially lead to excessive sedation. So patients should be encouraged to stop all marijuana use at least 2 weeks before surgery, but also to inform the surgical team about their history of marijuana use so that any measures could be taken to minimize risk. About medication interactions. There are a few known interactions, and there may be others that we don't know as much about. This slide summarizes those major interactions. Marijuana often potentiates medications, but in some cases it may actually decrease the effectiveness of certain medications. As far as the barbiturates and CNS depressants, those are two things along with fluoxetine that many individuals may also be taking or using some of those other medications along with marijuana, and they really do need to be informed about possible medication interactions. And then there's the safety concerns. I've gone over some of these already, but one is the potency of marijuana. We know that potency has increased considerably over the past several decades. And this is primarily because cultivators have crossed marijuana strains to increase the average concentration of THC, which again is the psychoactive ingredient in cannabis. It's very difficult to control the dosing of smoked or edible marijuana. Marijuana may also contain contaminants. A major concern is regarding pesticides. And there's very few controls over supplies that are intended to protect consumers of marijuana from some of those contaminants. As I mentioned earlier, our experience in Colorado has shown that accidental ingestion occurs, and we are expecting to see increased incidence of that as marijuana becomes more widely used in our state. And this has resulted in increased visits to emergency departments when children have ingested marijuana and experience things like delirium and need emergency support, at least for some period of time during that marijuana intoxication. There's a considerable amount of interest in how marijuana affects driving, and especially how it compares with driving under the influence of alcohol. Although research to date shows that alcohol poses a greater risk for accidents, marijuana absolutely also does raise the risk for accidents, probably 2 to 3 times. It does so by causing decreased reaction time and decreased motor coordination. And then, as I mentioned earlier, another safety concern is for those who are going to be having surgery, that they should avoid marijuana and disclose use to the surgical team. So now on to the brief intervention. So again, a brief intervention is simply a short conversation. It can be one conversation or more. It can be in person or over the phone. And the goal is to provide feedback and education about the substance, and especially to enhance a person's motivation to change their pattern of use. Brief interventions draw from the spirit and the techniques of motivational interviewing, and you'll see some of these motivational interviewing techniques highlighted in this slide. Very early in a conversation about marijuana, it's a good idea to find out what a person knows and believes. There are many sources of information out there, some reliable, some not so reliable, but individuals who use marijuana are fairly likely to have strong convictions and beliefs about marijuana and how it compares with other substances. So simply ask what a person knows, where they get their information about marijuana, how they assess the reliability of that information, how much comes from personal experience or the experience of others who've used marijuana, and how marijuana compares, in their view, with other approaches to addressing health issues, especially if they're using medical marijuana. So a technique would be to simply ask open-ended questions. What do you know about marijuana? Where do you get your information, and how do you assess that information? And then to reflect back what you hear them telling you. Be prepared to provide information about health and safety concerns related to marijuana, and to personalize that as much as possible, to tie it to a person's age, health, or other life circumstances, and also, importantly, to not overstate the risks or the harms that may result from marijuana. A key technique here is to first ask permission to offer information and feedback. Would it be all right if we talked about marijuana? Would it be all right if I gave you some information about some of the concerns related to marijuana use? Next, to express concern about things like potency and dosing. Again, offer that information with permission. And to express concern that a person could harm themselves by self-medicating to treat serious health conditions. Again, to offer that feedback with permission. Offering concern about self-medicating or self-management of chronic health problems can be a bit tricky because, of course, we want people to take an active role in self-care and to develop insights into what works best to help manage their chronic health problems. But we need to balance that with good oversight from a qualified medical professional, especially for long-term chronic health problems. So a few more brief intervention key points. So since we know that marijuana users in Colorado, especially those who primarily use it recreationally, may be at higher risk for other risky substance use, it's actually very important to bring other substances into the picture when talking about marijuana and link patterns of use that may exist between marijuana and other substances. This is a key way to enhance a person's motivation to promote insight and self-understanding about why they are using substances. in the first place, and how that could be negatively affecting their health and their life in general. So it can be helpful and important, again, to inquire about reasons for using any substance and to explore how that use may be related to stress, anxiety, and depression. Those things are things that are often going to come up in a conversation about marijuana and benefit from good listening and reflective listening to help a person develop that insight and explore options for the best ways to approach stress, depression, anxiety, and other challenges like that. In some cases, it's very helpful to explore other possible reasons that a person may want to consider changing marijuana use. For some people, health simply won't be the main reason. So for example, I've mentioned cost. Marijuana use can get fairly expensive. How it's affecting relationships. It's fairly common that people will report that someone complains or has expressed concern about their marijuana use. For some people, being a good role model for children, whether that be as a parent or as a coach or a teacher, may be a main motivator for changing use of marijuana. So similar to other substances, we need to leave the door open to helping people identify that these other reasons may become their main motivation for changing a pattern of marijuana use. So in Colorado, we've also begun to outline some possible ways to respond to common beliefs, the things we hear day to day about what people think and know about marijuana. And we welcome your input on this as well. But here's some of the things we're exploring in Colorado. So when we hear someone say, well, it's legal, so what's the big deal? Or it's safer than alcohol or tobacco. One way to respond could be, similar to other legal substances, marijuana actually carries some risks as well. We hear that marijuana is all natural. Marijuana may also contain harmful contaminants. Many all-natural substances are known to harm human health. When we hear that it treats serious health conditions and works better than prescriptions, we could respond by saying, it's important that a serious medical condition be managed by a qualified healthcare provider. Self-treatment could cause harm. No one ever died from an overdose of marijuana. In Colorado, emergency department visits are increasing. That's not only among children who accidentally ingest marijuana, by the way, but also we're seeing more marijuana intoxication among adult users as well. And that can include things like delirium, hallucinations, cyclic vomiting, the cannabinoid hyperemesis syndrome that I mentioned earlier. When you hear someone say marijuana is not addictive, very important that we provide feedback with permission that marijuana actually can be addictive, and in fact it's the #1 substance that adolescents are treated for when they have a substance use disorder. It helps with stress and anxiety. Could counter by saying it's important to identify and address underlying causes of stress and anxiety for long-term health and well-being, and that it's okay to drive after smoking pot. We know that marijuana increases the risk of auto accidents 2 to 3 times. Some examples of how we may want to respond to common beliefs about marijuana. When offering brief interventions and exploring some of the possible benefits of cessation or decreased use of marijuana, some of the things we hear from patients who have changed their use and decreased or quit using are that they experience improved mental clarity, that while they were using marijuana, their brain often felt foggy, that decreasing or especially quitting use of marijuana can improve motivation. Marijuana is known to decrease motivation overall. Of course, money will be saved if a person stops using. The motivation to protect major organ systems like the heart, the brain, other organs. decreased chance of having problems with fertility, healthier pregnancy, safer breastfeeding, and being a good role model for children, as mentioned earlier. A few key points about offering effective brief interventions in youth. When it comes to addressing marijuana use in adolescents and young adults, it's important to emphasize that use absolutely does carry greater long-term risks in this population. It can be somewhat tricky and challenging to provide strong advice to abstain and make sure that that message has been clearly conveyed, but to also be prepared to address harm reduction in a young person who's unwilling to abstain. So initially, it's essential to strongly deliver the message coming from a health and safety perspective about abstinence, such as your doctor or as your nurse, I strongly encourage you to avoid all marijuana use, especially because of how it can seriously harm your health when your brain is still developing. And then to ask the young person directly, what do you think about that? Be sure to very explicitly show that you're on the side of the young person, to advocate for their health and well-being. And that's in all cases, all the time, but also if you're going to approach and involve parents in the conversation, to really show that you're on the side, you're an advocate for that young person, regardless of what their decision is about abstaining from marijuana or not. And to state very clearly that you will continue to be an advocate and work with them, whatever they decide. To try to keep the door open for long-term conversation and follow-up is also critical. It's ideal to try to involve parents and other caring adults whenever possible, but it's important to note that disclosure of use should only be done with the consent of the adolescent. Some adolescents may actually be looking for help from a healthcare provider or another type of helping professional to approach their parents and talk about their use. They may actually notice and be convinced that they're developing a problem, but they're not sure how to ask for that help. And that's where we, in doing good brief interventions, can help bring up that subject and open that door to involving other caring adults. It's important to know your state laws regarding self-referral for substance use treatment. And a few points about motivational interviewing in adolescents. It's actually very well suited to adolescents. Some main reasons for that include that, first of all, it respects autonomy, personal choice. It affirms that again and again, that it really is your choice what you decide to do. I care about you and want you to do what's best for your health, but it is ultimately your choice. It's a non-confrontational approach to having a conversation and to responding to that resistance when it comes up, to deflect it, to roll with it, rather than confront it. Motivational interviewing promotes insight, self-understanding, and self-efficacy. And this could help equip a young person for many types of future life challenges, certainly other substances, other risky behaviors that they're likely to encounter as they're growing up. And motivational interviewing emphasizes a collaborative approach to problem solving and change, working with that young person, respecting their own insights about what's going to work for them and what's not. So in Colorado, in our SBIRT guideline that you can access on the HealthTeamWorks website if you're interested, we have outlined an approach to a brief intervention called the brief negotiated interview. And you can learn a lot about this from other sources as well. But I wanted to just briefly go over what is a brief negotiated interview. It does utilize techniques of motivational interviewing, but it's not at all necessary to be an expert in motivational interviewing to offer an effective brief intervention using this method. So there's 4 major steps. First of all is to simply raise the subject. Ideally, ask permission to have the conversation and offer feedback. Would it be all right if we talked for a minute about marijuana and your health? And then to provide feedback, not too much, but a little bit of personalized feedback. That can involve looking over with the individual their current patterns of use. What have they told you about their use? And verifying that it's accurate. Then to express concern about their quantity or frequency of marijuana use. To connect marijuana use to personal or family well-being, to their own health, maybe even the health issues that they've presented with, and to connect how marijuana could affect their goals for themselves. And then to always, once you offer a little bit of feedback, to elicit the person's response. What do you think about that information? How do you think that applies to you? Then the third step of a brief negotiated interview, to enhance their motivation. There are multiple ways to do this. One could be to simply ask them, what do they like and what don't they like about using marijuana? And then summarize that so they hear themselves talking. So what is it that you like about marijuana? And what are the not so good things about marijuana for you? And then just reflect that back to them. Another technique can be to assess their importance and or readiness to change using a 0 to 10 ruler. So on a scale from 0 to 10, where 0 is not at all important and 10 is very important, how important is it to you at this point to cut back or quit using marijuana? And then to respond appropriately depending on what number they pick. To ask them, even if they pick a very low number, so why is it even a little bit important to you to change your use of marijuana? And then to, again, develop the discrepancy between their behavior, the use of marijuana, and their current health or life issues, and to the goals they've set for themselves. How does your marijuana use fit with your goal of getting through college and getting to graduate school, or whatever the case may be? And then the fourth step is to negotiate and advise. To talk about a specific next step, a goal or a plan for reducing or abstaining from marijuana. To offer suggestions about possible ways to achieve that goal, but to, in all cases, ask a person, how would that work for you, or what might work better for you to help you reach your goal? Then again, the use of the 0 to 10 ruler to assess their confidence can be very valuable once they've set a goal. So how confident are you that you'll be able to stick with this plan? And if they are not feeling very confident, to explore specific barriers and challenges, offer solutions, help them problem solve how they're going to achieve their goal. And finally, to summarize the next steps so that you've gone over all the things you've talked about and summarize what's going to happen next, and ideally thank them for having the conversation. So this is one model that can be very short and effective for offering an effective brief intervention. And next, I'm joined by my colleague, Jenny, and we're going to do a sample brief intervention for you on marijuana. So first, let me introduce Jenny as my patient today. Jenny is 23 years old and came to the clinic today because of a cough that she's had for almost a month. She has no major health problems, and her physical exam today did not reveal a serious illness. All patients at this clinic answer brief screening questions to assess their use of tobacco, alcohol, and drugs. And that brief assessment includes a specific question on marijuana, since this is, after all, Colorado. So here is the follow-up conversation between Jenny and the nurse practitioner. So Jenny, I didn't detect any signs of a serious illness today like pneumonia. I think your cough will get better with some cough medicine, plus I want you to be sure to drink plenty of fluids.
Okay, I can try those things. I seem to be getting every cold that goes around, and I can't really afford to miss any more work.
Okay, well there's one other thing I'd like to discuss, if that's okay with you. We ask all of our patients here about tobacco, alcohol, and drug use. You said that you don't smoke or use any form of tobacco, and that you have an average of 2 servings of alcohol per week?
Yeah, no smoking, and I only drink a little now and then.
Okay, those are both very good choices for your health. You also mentioned that you've used marijuana several times a week in the past year. Is that right?
Yeah, it's a pretty common thing in Colorado, you know.
Yeah, I know it is. Would it be all right to talk for a few minutes about the marijuana?
I suppose.
So I'm curious, what are your reasons for using marijuana?
Well, lots of my friends smoke pot. It's just something we do when we get together. It's a way to relax. Plus, things are really stressful right now, and I've had a lot of trouble sleeping.
Okay. So you're experiencing quite a bit of stress, and it's affecting your sleep right now?
Yeah, the past few months have been really hard. They've laid off several people at work, and I've taken on a lot of extra work. And some nights all I do is think about the things I didn't finish at work.
And smoking marijuana seems to help with the stress?
I think maybe it does, at least sometimes.
Okay. So marijuana maybe seems to help sometimes, but you're also still experiencing quite a bit of stress and having trouble sleeping. Did I understand that right?
That's right. Plus, this cough makes it even harder to sleep. So it's really hard to say what's going on.
So, Jenny, about how often are you smoking marijuana?
I'd say probably about 5 times a week.
So almost every day, not quite every day, but almost every day?
Yeah.
Okay. So what do you know about how marijuana can affect a person's health?
Well, it's safer than smoking cigarettes, isn't it?
Well, it's definitely true that smoking cigarettes is very harmful to a person's health. But there are also some health risks associated with marijuana. In fact, people who smoke marijuana regularly may be more susceptible to getting colds and to develop a chronic cough. What do you think about that?
I don't know. I thought I was probably just getting cold because of all of the stress at work.
Well, you're right that stress is also harmful to your health. So some of the reasons you smoke marijuana are to relax with friends and to help you manage stress. I'm curious, what are some of the not-so-good things about smoking marijuana for you?
I don't know. I suppose I spend a fair bit of money on it, and it sure does add up.
Okay. It can cost a fair bit. Anything else?
Not that I can think of, unless maybe it is making my cough worse.
Okay. So on the one hand, smoking marijuana is a way to relax with friends and manage stress. But on the other hand, it's expensive, and it could be making your cough worse. Is that what I heard?
I guess, but at least it's not addictive.
Okay. Well, actually, we know a person can become addicted to marijuana.
Really? That's not what my friends say.
We know that marijuana can be especially harmful for teenagers and young adults because their brain is still developing. It's been linked to depression, problems with learning and memory, and some people do become addicted.
That doesn't sound good.
Yeah. So what do you think? Where does that leave you now in terms of your use of marijuana?
I don't know. What do you mean?
Well, we've talked about your reasons for using marijuana and about some of the health risks and the cost. Considering those things, on a scale from 0 to 10, where 0 is not at all important and 10 is very important, how important is it to you to quit smoking marijuana altogether or to cut back?
That's an interesting question. Maybe a 6 or a 7?
So it's somewhat important to you.
I suppose.
What makes you give it a 6 or a 7 and not a lower number?
Well, this cough is really interfering with my life and making it harder for me to keep up at work. I didn't really think smoking pot could have anything to do with it, but if it does, then that might be a reason to quit for a while.
Okay, so to help with the cough is one reason. Anything else?
Well, I'm going to have to think about some of those other things you mentioned.
For example, what?
You said how it could affect a person's memory.
Okay. So the way marijuana can harm a person's brain may be another reason to make a change for you?
I guess so.
Okay. So what's the next step you think you'll take?
Well, maybe I'll try laying off the pot for a while and see if that helps with my cough and go from there.
Okay, that sounds like a good idea. So you plan to quit smoking marijuana in the short term and to consider some of the other reasons to quit or cut back longer term. Did I get that right?
That sounds right.
Okay. So Jenny, I'm curious, how confident do you feel that you will be able to quit smoking marijuana temporarily? Again, on a scale from 0 to 10.
I'd say around an 8.
Okay, so you feel pretty confident that you can take this next step?
Yes, I think so.
Okay. So this sounds like a good step you're taking for your health. How about if I call you in a week to check in about your cough and your plan to stop smoking marijuana, at least temporarily?
Sure, that sounds okay.
Well, Jenny, I want to thank you for having this conversation with me today. Please contact me anytime for any reason.
Okay, thank you.
So that's a sample brief intervention. We'll welcome your feedback on that and your ideas. Just a couple more slides before we have questions. When talking about marijuana, it's important to be prepared to identify possible cannabis use disorder. And so this slide lists the criteria for a substance use disorder from the DSM-5, and I'll refer you to the DSM-5 for more information. It is slightly revised from the DSM-4. So with any substance use disorder, you'll see a person beginning to use more than intended, some compulsive use, spending considerable time and money on their use, cravings and strong desire, and of course it begins to affect their ability to function in other aspects or other areas of their life. So it's important to be prepared to ask questions and identify possible substance use or cannabis use disorder, and then use an effective brief intervention approach to try to motivate a person to seek further assessment and specialized treatment if indicated. And then finally, I'd like to point out that in Colorado, we are developing a new supplemental tool to address marijuana in healthcare and other settings. This slide shows you a draft of that tool. We hope to complete the tool and post it to the HealthTeamWorks website, along with all the other SBIRT guidelines and tools that we've developed by the end of December 2013. So if you're interested, please look for that. It summarizes key health information for both adults and adolescents, and covers some key points on delivering effective brief interventions on marijuana. And that's it. We thank you very much.
Great. Thank you, Carolyn, and thank you to your colleague for assisting you with the role play. I think that gave us a really nice glimpse of what it sounds like, what it feels like. I think it also gives us a reminder of when you're having that BI conversation and you're weaving in your MI skills, those motivational interviewing skills, the tone, and it's so important about how it's conveyed to the person that you're working with. And I just thought that was such a great example of a brief intervention and what we try to achieve with that neutral tone and being very informative and moving people along. So I just thank you very much for that nice little gift to our webinar. We haven't had that before, and I think we'll want to incorporate that in the future. And thank you so much for sharing all this wonderful, rich information about your experiences in Colorado, some of the things you've learned from the research that you've been doing, as well as giving us a glimpse of the protocol that's going to be coming out. I have to say, of the guidelines, actually in Colorado they refer to them as guidelines, and I refer to them as protocols, but the guidelines that are coming out, I have to say, some of the best guidelines I've ever seen around screening and brief intervention have come out of SBIRT Colorado and peer assistance and HealthTeamWorks. It's just really exemplary work, and I have used those so many times in the trainings that we do. And what I'd like to do is post a link to the current guidelines that are available, and you could let me know when the guideline is out for marijuana. Could you tell folks what guidelines are available right now from your organization?
Sure. Well, HealthTeamWorks works on a lot of different health areas. So we actually have 22 clinical guidelines. And when I say guidelines, it's important to emphasize that HealthTeamWorks does not grade the evidence on any prevention or chronic disease issues. We summarize the best available evidence, often from national organizations. So we have a total of 22 clinical guidelines covering a range of health topics, and those that particularly relate to substance use would be the SBIRT guideline. And the SBIRT guideline has a one-page front and back summary overview of the SBIRT process, including brief screening, further assessment, and brief interventions. It also addresses tobacco as part of the substance use picture, and it addresses how to help people who have more problematic use of alcohol or another substance using approaches like brief therapy or referring a person to treatment. And so along with the SBIRT guideline, we have several other supplements, including a prescription drug abuse prevention overview, a fetal alcohol spectrum disorder overview. We developed a CRAFT toolkit. The CRAFT questionnaire is a screening tool to assess alcohol and drug use in adolescents. And we have a toolkit that we're grateful to the Boston SBIRT project for allowing us to adapt their toolkit. And several other supplemental materials, including sample brief intervention, information about how to set up a practice setting to begin to do SBIRT efficiently and effectively. We developed an online training module that addresses SBIRT implementation. And we also have a tobacco guideline, a standalone tobacco guideline, and a depression guideline, both topics that closely relate to SBIRT, along with several other clinical guidelines that many of those have a role for addressing substance use. And all of those materials can be accessed on the HealthTeamWorks website, listed on this slide.
That's wonderful. That's terrific. Thank you so much, Carolyn. And I want to bring us to an opportunity to answer a few questions. We have some really good questions that have come in, and a lot of thank yous for the wonderful information that you've shared today. So again, thank you very much. Let's start with a couple of questions about recommended screening tools for marijuana use. What tools do you recommend?
Well, our standard approach to further assessment when you identify possibly problematic alcohol or drug use in Colorado has been the audit or the assist or the DAST. And we don't, to the best of my knowledge, in most of our sites at this point, use a specific assessment tool on marijuana. Go ahead. I'm sorry.
That's my experience. That's my experience too. So it sounds like you're using a lot of the core validated questionnaires that are out there now. And the SIS specifically has a question about marijuana use as well as other drugs. So it's woven into the larger screener. And the DAS looks across substances in general. So marijuana would be included in general drug use. Have you adapted that specifically just to ask about marijuana?
We have not, but we are actively looking at how to do that assessment, that going beyond just the brief screening, to get more useful information about a pattern of use of marijuana.
Okay, terrific. So a couple other questions here. It sounds, can you talk about whether Colorado SBIRT has been, their program focusing on marijuana has been mostly directed to adolescents, or have you been using this with adults, older adults, maybe special populations? Some of the attendees are mostly working with adults and want to know whether the protocols you've been sharing with us and the guidelines can be used with both groups.
So the data collected through the SBIRT Colorado initiative only includes adults. However, many of the sites are primary care sites or emergency room sites that see not only adults but all ages. So certainly the protocols we're recommending could be applied in a general health care or mental health setting to all ages. I've actually done some training. There was some interest from an integrated healthcare system in Colorado that sees a lot of older adults on how to specifically tailor conversations to older adults. And some of the issues that I highlighted for that had to do with things around cardiovascular health, lung health, medication interactions, coordination in driving, and falls, things that older adults are already concerned about, and sometimes due to deteriorating health have other reasons that those issues are arising, and marijuana could exacerbate existing health problems. Immune function would be another that resonates with a lot of older adults. So yes, we're trying to address marijuana across ages, and in fact, in the next year, early in 2014, we have some counties in Colorado that we hope will be pilot testing implementation of screening in school-based health centers, and some community coalition activity and support behind that initiative. So we hope to be learning more about how to address marijuana among adolescents through the school-based health center and maybe to some extent through school nurse offices.
And then in that case, you would be using would you be using a craft tool or a modified craft tool to help with the screening piece of it?
Yes, we would encourage those sites to use the craft as the validated screening tool, and then we would provide training and support as they learn to do brief interventions, probably using the brief negotiated interview model of brief intervention.
The BNI model. In fact, the BNI Art Institute that has developed the BNI model that you've been talking about has a wonderful website, and we can get the website posted here for you, and it has additional resources on training around the BNI model. It has access to YouTube videos so folks who are interested in getting more training on how to do brief intervention for marijuana use can do some observational learning around that, use it as a learning tool with their colleagues, perhaps in clinical supervision kinds of training sessions. And I know that they have, and this relates to another question we have about some of the research, they have a wonderful reference list that has a lot of some of the outcomes, but also lessons learned, lots of different articles, research articles, peer-reviewed articles that have been posted to their website that talk about the outcomes related to doing brief intervention for marijuana use, for example, in pediatric emergency settings, and a variety of other places. So I would encourage folks who are looking for more research and peer-reviewed scientific journals, articles, to go to the BNI website and take a look at the reference lists. And Carolyn, you may be aware, I don't know, do you know if HealthTeamWorks or Improving Health Colorado has any additional research articles posted around the impact, the outcomes, whether it's related to increased ER visits or costs? Do you know of any other sources we could point people to around brief intervention for marijuana use?
Well, the SBIRT Colorado initiative did complete a literature review on the health effects of marijuana. That's fairly recent, and that should be available through the Improving Health Colorado website. And colleagues from the SBIRT initiative are going to be publishing some of the results on marijuana use in Colorado. I believe that will happen in 2014. And it's an ongoing issue that we're gathering a lot of information for this new supplement. And the supplement will be posted, like I said, we hope by the end of December, but also we will include a supplemental reference list so that anyone who's interested can find out where we gathered the information that's available or that's summarized in the supplement. The Colorado Department of Public Health and Environment does have a section of their website devoted to marijuana, especially the process by which people can petition to have additional indications added for medical marijuana use in Colorado. So there's a few different places that, through our Colorado resources or initiative, that people could potentially find more information. I also happen to know that there's a very lengthy and interesting Mayo Clinic proceedings article from 2012 that summarizes what we know about potential medical benefits of marijuana, and I found that article to be very intriguing, including the sort of editorial perspective, and I'd be happy to share that as a resource for people who would like to explore potential benefits and the balance of benefits and harms around marijuana.
Oh, that's terrific. We've posted in the chat feature the improvinghealthcolorado.org website, and we'll make sure that we post the HealthTeamWorks website and these others that you have mentioned. That's terrific. We're always, you know, on our big initiative websites, we are continuing to try to, as these articles and the research come out, become publicly available. So we're not doing any copyright infringement as those become publicly available. We do try to update our website. We have resources and links to articles. They're grouped by content area on a variety of topics to try to give you some hot links to some information. So we'll try to post some of that there. And we will post those links for our websites as well later on. A couple of other questions here. In Colorado, if the individual has a card for medical marijuana and is stopped by the police, is that individual cited for a DUI or other specific infraction?
Well, you know, I believe, I honestly can't speak fully to the legal issues around marijuana use, but the use of marijuana is supposed to be confined to a person's residence, and yes, law enforcement is prepared to view use while driving as an infraction, and to cite people for that. But from what I have read and understand of where we're going, and as a country, and figuring out how to approach marijuana use, especially while driving, it's, you know, we have a lot to learn still, and there's not always clarity for people who use and for people who are even enforcing the laws around how to carry out the laws effectively. So, you know, the recreational use of marijuana is supposed to be confined to people's residences, but, you know, people will use marijuana outside, and we do hear of complaints from neighbors that feel that they're, you know, being exposed somehow and would rather not to the use of marijuana. So I honestly can't speak to that issue very intelligently, but I would be happy to look for more information and to try to answer any questions related to this issue.
Sure. Well, thanks, Carolyn. If you do find a link to somewhere on the web or a document that helps, you know, clarify that, we'll be glad. Just send it to us. We'll be glad to post it to the website where the materials are for the PowerPoint today. I appreciate that. Another question for you here. What sources of reliable information do you recommend to share with clients? This, I imagine, this person could be electronic, it could be paper and pencil. You know, what kind of reliable information about marijuana use would you recommend? Can you point us to any resources?
Yeah, so, you know, That's a good question, because there is information out there. We have some short summary brochures that we have used in the SBIRT Colorado initiative to provide people something to take home that summarizes information about alcohol, marijuana, other substances. I think the major national websites and the information they provide has sources of information. We do have one brochure that was developed in Colorado that gives advice to parents about talking about marijuana. I actually don't know exactly who the source of that is, but I could find that and share it with you. But I do think we need to look for or develop better summary resources for people that divide some of the information into medical issues and safety issues and address both medical marijuana use and recreational use. I don't think we have the ideal pamphlet or brochure yet, and perhaps others who are on this webinar know of some materials that they could share as well.
Oh, that's an excellent idea. So folks who are out there and have been using some good materials or can at least point us to some that we can recommend that are good, reliable information, we'd certainly be grateful for that. I was looking more into this topic not long ago, and I found some educational brochures from the Indiana SBIRT site called We Ask Everyone. I guess as to convey, it's sort of standard practice that we ask everyone about their marijuana use, and so it has some information, educational information in there, as well as the BRITE, B-R-I-T-E, SBIRT site down in Florida. They have a website that contains some educational materials, both in English and Spanish, talking about the effects of marijuana and so forth. And the BRITE program has worked with older adults as well as families and children, and so they may have some other materials for specific populations around specific kinds of, like you were mentioning earlier, falls or other kinds of specific kinds of things that older adults might experience. So I would encourage folks to look at the different SBIRT grantees like these. The SBIRT grantees and their websites are listed on the SAMHSA website. That's S-A-M-H-S-A, SAMHSA website. Great. A couple more questions for you here. Let's see. Let's see. Is medical marijuana smoked or taken in a pill form?
It can be done. It can be ingested different ways for different conditions.
Okay. And maybe we can find some more information about that on the web and provide some links for that. I don't know the answer to that either. And what is the percentage, do you know, of THC in medical marijuana? That is it like the marijuana of the 1970s with low THC levels, or current levels which are significantly higher?
To the best of my knowledge, that's actually one of the health concerns. It is higher THC content. It's been, strains have been crossed, and cultivators have increased the potency to increase the effects, the psychoactive effects of marijuana over time, so that medical marijuana also tends to be considerably stronger than the marijuana that was more commonly used in the 60s and 70s.
Okay. And let's see. Do you ever address the idea of marijuana being a getaway drug to further substance abuse?
Oh, a gateway drug?
I'm sorry. Did I say getaway? I meant gateway. Sorry. Yes, gateway drug.
I was imagining getaway as get away from your problems drug.
Yeah.
Yeah, I mean, I think one of the things I tried to address in the presentation is that some of that is not clear yet. Especially among adolescents, what are the substances they tend to be starting with nowadays? Is there a change in that? But definitely, especially since we see amongst recreational marijuana users a higher probability that they're using other substances. That I do think that whether marijuana is the starting point or they go to marijuana after starting with something else, I do think substance use co-occurs, and we need to be prepared to sort of bring the whole substance use picture up and explore with a person, where did they start, but how are these different substances and their use related in a person.
Great, thank you. And one of our attendees was nice enough to respond to your question to the audience, which was to mention that Massachusetts has a good brochure with reliable information for adults called 10 Questions to Consider Before You Light Up. And it's available through the Mass Clearinghouse, MASS Clearinghouse.com. So that's nice to know about that resource.
And I am familiar with that. I highly endorse that resource. I've seen that.
Great, and it says here it's reflecting the new medical marijuana law in Massachusetts, so it's being updated, or it is being updated to include that. That's great. Let's see how we're doing on time. We have about 4 or 5 minutes. Let's see. Let's do one more question, and then we will move to wrapping up. Let's see what we have here. One of the slides says risk level among past 90-day users. Can the word risk be defined? Is it risk generally, risk of something specific? Just want to make sure they clarify when you're talking about risk. What does that mean, risk for medical marijuana use?
So we were looking at how likely a person was to score at moderate or higher risk for their use of a substance, including marijuana, meaning that they, higher risk would mean that a person is experiencing personal, legal, relationship problems associated with their use of marijuana. And so that's something that's gathered partly through the assist. And so that's what we were referring to when we were comparing levels of risk amongst users of medical marijuana to levels of risk amongst those using recreational marijuana. Does that answer the question?
Well, if the person is still on, they can certainly let me know if that's what they were trying to get clarification on. I think it might for me, but sometimes we just want to make sure that the attendees are getting the kind of information they were looking for. It can be difficult sometimes to tell through the different way the questions are wording. So, oh yes, it did answer the question, so thank you very much. Thank you. Appreciate that, Carolyn. Okay, well, I think what we'll do is we do have more questions, but I think what we'll do is wrap it up. If there's a way for us to get some additional information in response to these questions, we'll post those. So we'll close the presentation now, and we're going to just do some wrap-up. Okay. So I just wanted to remind folks that the PowerPoint slides are posted. They'll be posted to our website, both the Big Initiative website, hospitalsbirt.webs.com. Currently, we have a link that's in the chat box that where they're also being housed right now on the NADAC website, which is a collaborator of the Big Initiative and with the National SBIRT ATTC. So the PowerPoints will be there. The recording of the webinar will be posted there as well for future viewing. I know some folks came in late and said they'd really like to be able to catch up, so you're going to be able to go through it at your own pace from start to finish there. Also, I wanted to remind you to take a look at the website, our website, because we have a monthly webinar series posted there. We have some really great topics coming up, but we also have some archives that complement Carolyn's presentation today. on special populations in marijuana use for women of childbearing age, as well as a program that is related to training residents and others around how to do brief intervention for marijuana use that's already available to you, archived, that you can listen to. But we have a lot of great topics coming up, looking at how nurses incorporate SBIRT into their work, how SBIRT's integrated into criminal justice systems and certain settings, and a variety of other very exciting presentations to look forward to. And I also want to remind you that we are offering 3 CEs for this. You're going to get a CE quiz. You have to complete that CE quiz to be able to earn those CEs. And even more importantly, I can't stress enough how important the very brief evaluation form is for you to complete. That, again, helps us to maintain bringing you this high-quality education and keep us working for you to provide the training and kinds of technical assistance that you need in your setting. So please, 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 and we have posted that short survey to the evaluation form in the chat feature. It's a SurveyMonkey evaluation form, and we've also posted for you the quiz link so you can earn the free CEs. So I am going to close there and thank everyone. Thank Carolyn and your colleague, but Carolyn specifically for this rich information. Thank you so much. It's such a pleasure. And to the attendees, thank you so much for joining us. And please look forward and attend our webinar series coming in the coming months into the new year. Thanks so much.